Welcome to another wonderful leisurely chat on Global Health Talks. And today I'm especially excited on a lot of levels. I will introduce you all to Harjit Gill, the CEO of an organization called APAC Med. And that's going to be the focus of what it is we'll talk about today. But before we get started, I want to welcome you. I want to thank you with gracing our show with your presence. We now are able to add Singapore and Southeast Asia in large measure to what it is included in Global Health Talks. And there's very much an accent on businesses and organizations and incentives that are made for the world to sort of equalize itself in all kinds of medicine, particularly med device and other. So welcome, Harjit.
Thank you, Mike.
Let me get you started off. You just spoke at MedTech Forum, as I understand. And I'm wondering, what was the main theme of that forum, and what sort of talking points did you concentrate on?
Just for the audience, so MedTech Forum is APAC Med's flagship event of the year. We put together for the industry. So we've just finished, and it was once again fabulously inspiring to meet so many speakers. I think this time around we had close to 1,700 attendees from all over the world, and about 145 speakers. And the most important thing, I think, this year has been pulling the industry together to really look at how do we emerge stronger post the pandemic, as we now start to come out of the pandemic and move from pandemic mode to endemic mode. So our whole event was very much around placing bets for the future. So the conference theme was Health Futures 2025. And it was around what are the smart bets as industry leaders we need to place to secure access to healthcare. So we looked at the role of the patient as our patient becomes more and more health literate and empowered around their own healthcare. That was important to look at. We looked at new care models. I think later we'll talk a little bit about digital health, but a lot of new ways of bringing care to people. But I think the discussion is around getting the regulatory approvals and reimbursement pathways. We looked also specifically at this region around capacity and capability building, especially around the regulatory function. Because it is a region that's very, very diverse. And in some parts of the region, on the one hand, excuse me, you have innovation and a lot of learning there for the regulatory community. But then also in other parts of the region, you've got the issue of access. And it takes a long time to get products regulated. So, and it's directly related in some part to a lack of capacity there. And as I mentioned, we looked also at innovative collaborations, because I think that's one of the things COVID has shown us. We've had to collaborate as an industry and as an ecosystem if we're really going to tackle some of these bigger challenges faster. So yeah, that was it was a 2-day conference. We also had our first CEO summit. So APAC CEOs coming together to discuss these issues. Plus a whole day of discussions, panel discussions, individual discussions around the themes that I've just mentioned.
Harjit, this is quite remarkable, because I think I should let the viewers know APAC Med is a baby. It's been around since 2014. And yet, as I understand it, when you were talking about the attendance and the access to the latest MedTech Forum, it's up 40% from the prior year. I mean,
yeah, so it's growing massively. But I think that's a great thing in terms of bringing the industry together, because it's only through collaborating like this can we really move the needle out here in terms of access and affordability. So we are indeed quite a baby. So Our sister organizations, of course, APACMed in the US, MedTech Europe, and many trade associations throughout the region. So we're 2014, I think we now have close to 300 members. And of course, all of the bigger industry members coming together. We provide very much a neutral platform. So we are the voice of industry out here. So a neutral platform through which people can engage on public-private dialogue. The work that we do is done through our committees. The committees have close to 600-700 people from the industry working together on key themes. And anything around shaping policy, building capacity, driving innovation. So these are sort of the areas that we work on. Plus, we have a partnership with MedTech Innovator from the US, where we screen startups throughout the region. And every year, then, of course, the highlight of that entire process is selecting a winner at our MedTech Forum.
I think, you touched earlier, sort of parenthetically, on including and putting a target accent on the patient directly.
Yeah.
And I can tell you this is a recurring theme that we see in global health talks. And in my own personal experience, I have spoken to doctor groups about this idea that the paradigm for the medical business, which 15 years ago was strictly B2B. A hospital or a medical company would have a detail spokesperson or salesman walk into a hospital administrator's office or into a doctor's office, and that would be the line of communication. And now, clearly, it is B to C to B. And, health information on the internet, for example, is the number 2 most searched category.
Of course.
And this is, this whole consumer/patient, and really they're 2 different things, but they're not 2 different things, because somewhere along the line, most consumers have to pay for these things. And for the ones who can't, it's problematic in other ways. But of course, we're talking to people now who are developing clinics in the cloud, who are working on equality globally to bring the poorest person up to the same standard as the wealthiest person. And so you are sort of sitting on a powder keg there, because as I understand it, Asia Pacific is poised to be, if it's not already, the number 2 MedTech market in the world. Am I right?
Yeah, so I think in the next couple of years, it will most certainly become the number 2 market. It's just over 100 billion in terms of size, so a massive opportunity. Growing, I think anything between 8 to 10% in terms of CAGR. If you look at the region, though, it's also massively diverse. So in this region, you have the mature markets, Japan, Korea, Australia. Then you've got emerging markets, still emerging when it comes to healthcare, like the ASEAN region. And then, of course, you've got the really big countries like China and India that are growing fast. But still, on average, in this region, we spend less than 5% on healthcare. So that in itself is a challenge. We're 60% of the world's population, an aging population, where chronic disease is on the rise. So we need to do more. We need to have more creative, scalable solutions that actually provide affordable access. So I think that's going to be, sorry?
I'm sorry to interrupt you. I apologize. When you said aging population, I wanted to ask you about that, because it is certainly increased in the United States, and coincident with its increase in numbers has been the compressed life expectancy of the elderly.
Yeah.
Now, obviously, when we go through a pandemic, a certain amount of that is to be expected. That's a little asterisk on the number. But the reality is, there's a huge dynamic that's happening right now. Can you talk about what range of med tech companies you're working with in the region, and give us some sort of idea of what subspecialties and what kinds of companies these are?
Of course, yeah. So we APAC Med is built, membership base is built up of I would say around 40% of the companies are coming from the major med device companies globally. So we've got all of them in terms of membership, from J&J, Abbott, Baxter, Medtronic, ResMed, Siemens. So all of the big device companies. In total in the region, we have around 25,000 med tech companies throughout the region. So quite a big base, employing close to 350,000 people. So I think you know these companies quite well. And
I certainly know Medtronic, and I launched Baxter's operating room division in a younger life. So yes, I do. Yes, I do.
So if you then look at the kind of disease states that are prevalent in this region, obviously cardiovascular, orthopedics, diabetes. So the kind of businesses are in hospital, not necessarily in the home. So we're also now getting a number of other companies joining us. So sorry, just to come back to it. So 40% of our membership base are coming from the big med device companies. And then we have, I would say, about 50% of our base is now startups from the region, working on many of these new innovative solutions. And around 10% of our membership base is what I would call associations, other associations, and knowledge providers. So a lot of consultancies in many different spaces. So typically, a lot of the work that we do then with our membership base, and it's twofold, is on the one hand, how do you work with the med device companies that we are that are members on bringing their solutions and innovations to market faster? How do we build this region up so that you don't have to wait 2 to 3 years for regulatory approvals? You know, how can we also leverage the learnings that some of the reference markets, some of the bigger markets can transport into some of those developing markets? So that's on the one hand, and the committees that we work on with these companies are around regulatory approvals, legal and ethics, compliance. We look at digital health, and we also look at government affairs and market access. So really looking at market access in the region and reimbursement pathways. And with our startups, what we try to do is we are the bridge between corporates and startups. So we're a neutral platform, and we try to facilitate sharing of knowledge through our MedTech Forum partnership, where a lot of our bigger companies are there and are actually on the boards of assessing who these smaller startups are when we go through the entire selection process and competition process. So providing that bridge is also important, because I strongly believe that as a company, you can't innovate anymore on your own. Gone are the days where innovation was closed. I think it has to be open, and it has to be a way that you are connecting. There has to be a way that you can connect with startups, but also with other parts of the ecosystem, because I think that's the other important thing for us in healthcare is none of the solutions that you can develop in isolation. So you need to be working with providers, you need to be working with payers, you need to be working with startups, and you need to be working with health authorities. So I think bringing that ecosystem together that's one of the things that we strive to do.
Yes, it's very, very interesting. So much of what it is you've said. And two things strike me. The first is, and this goes back a little bit to my PBS show, but we find tremendous passion especially in med tech, with companies that either were started by or are driven by people who have that problem in their family. That's the driving mechanism for all of it. And so that's one thing that I've really noticed. I see that the aging population fits so nicely into that dynamic. There is so much that affects them, they need help with. What are some of the trends, Harjit, that you're seeing with regard to seniors? And also, what are some of the hurdles that we still need to cross to serve them?
Yeah. You know, the last few years have been massively, will be massively transformative for healthcare. Let me put it that way. I mean, we've started that transformation.
Yes.
And let me start first with COVID. So if you look at the impact of COVID on the patient and the consumer, we are now so much more health literate than we were 2 years ago. We're talking about the kind of tests we want to take. We're talking about the kind of vaccines we want to take. And I think this health literacy has made us really conscious of the fact that we need to know and want to know what's happening with our own healthcare, but also the healthcare of our immediate family. And I think it's not just the aging population, but it's also the immediate family that take care of the aging population that will look for solutions that actually allow you to bring more and more healthcare out of its traditional setting. So I think that's one thing. COVID has impacted our health literacy. I think it's also made us realize that healthcare can happen in different settings, and a lot of these settings are really supportive and conducive to looking after the aging population. And telemedicine is, of course, one of them, but also remote care monitoring. If you look at, remote care monitoring, and we're doing quite a bit of work on that in APAC Med, that is obviously a space where taking healthcare out of the hospital into the home, where you're managing chronically ill patients or patients who've been released from hospital and can be released from hospital faster, plus the whole area of population health management, where you're looking at certain chronic diseases and managing those chronic diseases. I think this is where really that transformation is going to happen. And it will serve us all well, not just the aging population. But of course, the hurdles, and there are, I think, everywhere in the world, and you've alluded to them as well earlier, the hurdles are very much around reimbursement and regulatory pathways. So it's not even so much that we don't have the mind space of the consumer or the patient anymore. I think that transformation has started to happen. But I think making our ecosystem a little bit faster and easier to work with, that's where the challenge is. And that's everywhere in the world, and not just in Asia Pacific. So I mentioned earlier our whole project around remote care. Surprisingly enough, if you look globally at the number of use cases that there are where you have a solution and that solution is then integrated into a health system and then reimbursed, there are very few use cases available globally. So we try to look at what is happening elsewhere in the world, in Europe or the US, or even within, this region. And then we use those use cases as baselines to start with in terms of learning for our own healthcare systems throughout the region.
Here is the conundrum that I'm a bit of a student of systems throughout other countries. And the one thing that always comes back to me, and this is very simply put, America is a country that thrives and makes a lot of money on treatment. The entire system here is built on what can we do to treat you? The reality is, in most of the world, particularly the impoverished world, there is no idea of treatment. That is an impractical answer. And the fact of the matter is, it's about preventive medicine. And there's so many different types of medicine right now, and so many things that are happening. As you look at Southeast Asia, and there is really a unique combination of countries there, but it certainly isn't a one-size-fits-all answer. What is your process for evaluating a need in Thailand versus evaluating a need in Singapore?
Well, they're both very different markets, right? But a lot of the challenges are there. Let's take aging population. And I would say Singapore as a country is very well organized. If you look at the regulatory authorities here, HSA, we use them as a reference market, actually for countries like Thailand, Vietnam, Malaysia, Philippines.
Yeah.
So one of the things that I think is really important in this region is to learn from each other, but also learn from what else is happening outside, because it's just a way to fast forward. And healthcare has been typically so fragmented with everybody doing their own thing. So I think we have to break down those barriers. And some of the projects that we do are really around how do we leverage the learnings coming out of each of these markets. So just coming back to Singapore and Thailand, we're actually doing a project right now called Regulatory Reliance, where we look at certain medical devices that have been approved, regulated, reimbursed in Singapore. And then we work with Thai FDA to say, so what are the learnings here that we can take to help you fast forward access? And I think this is the kind of work that we do. It's slow. It requires a lot of collaborating and facilitating. But I think actually this is where, as a trade association, you can have impact, because you're building advocacy in these spaces. And for me, that's what keeps me excited about this region and keeps me excited about the work that we do, because I do think by working together on these sort of issues, it may be long-term, but it's laying down a great foundation.
Oh, and it's so important, Harjit, because, for example, a country like Thailand with 70 million people has the majority of those people in rural and largely inaccessible areas. And they are a completely vulnerable population. And there's only so much they can do through the government-run clinics, which are, basically, come on in, we'll take your temperature, here's an aspirin, go home. And the really fine hospitals are cost prohibitive. And so whatever we can do in that regard, I think will be hugely, hugely significant. What's our message to patients? Why is this a good thing? Why should you perk up your ears and listen?
Well, I mean, our whole reason for being is to provide affordable access, right? I mean, ultimately, that's what we want to do in Asia. It's a massive market. It's a diverse market. So, of course, for anybody thinking of coming out here and looking at providing health solutions to patients, it's a massive opportunity. However, there are hurdles and there are challenges. But I think if I could put it in a nutshell for both the patients and the med device industry, the next 10 years are going to be massively transformational for Asia. As you see, the actual expenditure on healthcare is so little, we will need to have creative solutions that provide this access. Mm-hmm. And, you've mentioned some companies and some interesting new technologies and solutions that are being provided. So I think this is where there's a real need for innovative solutions if we're going to be able to tackle some of these bigger challenges. And that's where I would encourage companies to come out here and to have a look at that opportunity and start working on some of these bigger challenges. And when it comes to patients, I mean, it's all, of course, not so much about treatment anymore, but I think COVID has shown us that, we are responsible for our own healthcare as well, if we can. And in whatever way, shape, or form, we need to be better educated. We need to be better educated around the kind of lifestyle that we lead and around some of the choices that we make. So I think that's also another space for patients. You can expect to see a lot of that now, and a lot of governments will be working on that space. We'll be really looking at health, population health management.
Harjit, your mom would be proud of you. As we all are. Thank you so much. I hope we can generate another conversation and spin this out across different channels as you continue to grow. Thank you so much for the wonderful work you're doing.
Thank you, Mike. It was a pleasure to talk this morning.